Why does the first heart sound occur exactly when it does? And why does the second heart sound follow later? To understand heart sounds, murmurs, and even many cardiac pathologies, you must understand the cardiac cycle. In the next 8 minutes, I'll explain it step by step, clearly, logically, and exam-focused. We'll begin with the definition, then go phase by phase through diastole and systole, then integrate pressure, volume, and heart sounds using the Wiggers diagram. The cardiac cycle is one complete heartbeat. At a heart rate of 75 beats per minute, one cycle lasts about zero point 0.8 seconds. It consists of atrial systole, ventricular systole, and diastole. The cardiac cycle is divided into diastole and systole. Diastole includes rapid filling, reduced filling, and atrial systole. Systole includes isovolumetric contraction and ejection. Understanding valve status in each phase is the key to mastering this topic. During early diastole, ventricular pressure is low. The AV valves, mitral and tricuspid, are open. Blood flows passively from atria to ventricles. Ventricular volume increases rapidly. This phase accounts for most ventricular filling. Atrial systole pushes the final 20% of blood into the ventricles. This becomes important during exercise or in patients with stiff ventricles. Loss of atrial contraction, such as in atrial fibrillation, reduces cardiac output. Now ventricular systole begins. Ventricles contract. AV valves close, producing the first heart sound, S1. All valves are closed. Pressure rises rapidly, but volume does not change. That's why it is called isovolumetric contraction. When ventricular pressure exceeds aortic and pulmonary pressure, semilunar valves open. Blood is ejected into systemic and pulmonary circulation. Ventricular volume decreases. This phase determines stroke volume. After ejection, ventricles relax. Semilunar valves close, producing the second heart sound, S2. All valves are again closed. Pressure falls rapidly, but volume remains constant. That is isovolumetric relaxation. The Wiggers diagram integrates everything. It shows aortic pressure, ventricular pressure, atrial pressure, ventricular volume ECG heart sounds. If you understand this diagram, you understand the cardiac cycle completely. Let's summarize. One cardiac cycle lasts zero point 0.8 seconds. Valve status determines each phase. S1 occurs when AV valves close. S2 occurs when semilunar valves close. And the Wiggers diagram integrates all events into one unified view. If this made the cardiac cycle simpler for you, like the video and subscribe for structured physiology lessons every week.